Hi, I'm Dr. Mark Fulcher from Access Sports Medicine. Welcome to The Spin, where we're here to help you stay up to date with the latest and greatest in sport and exercise medicine. Tonight, I'm joined by my colleague, Jackson McKellar. I met Jackson working together at the Warriors until very recently. He was the rehabilitation physiotherapist there. He's recently moved to Brisbane to take a role with the Brisbane Lions in the AFL. So thanks very much for joining us tonight, Jackson.
No worries. Thanks for having me.
Good stuff. So tonight we're going to talk about some issues relevant to ACL rehab. For those of you following the Warriors, it's a very topical subject for us. I'm really hoping to get some insights from Jackson about what's the latest and greatest and newest things with ACL rehab. So my feeling, Jackson, is that ACL rehab's changed quite a bit over the last few years. There's more technologies, different thinking about the way that we approach rehab. From your experience in both the NRL and AFL, what do you consider to be good quality rehabilitation?
I think you're right that rehab has changed quite a bit. We've probably moved away from a time-based model, and now it has become, rightfully so, completely objective. I think from a rehab perspective, we're now finding out a lot more, and you touched on the technology. We're finding out a lot more about what physical qualities athletes are losing from the injury. So obviously you have the trauma, the initial trauma from the knee, but then, the rehab journey focuses a lot on obviously the physical qualities that we lose. And that starts with obviously losing strength, muscle bulk, and then sort of builds onto that. Then obviously rate of force development, power qualities, etc. So I think in a nutshell, a good quality rehabilitation obviously focuses on restoring those qualities, but then also restoring the athlete's confidence in returning to play, and returning to play at a level that they're confident that they're able to do their job. And I think probably what we've noticed in the last couple of years is it's that end stage. Physios are really quite good at the acute stage, settling a knee down, getting basic strength back. But the more we start to test different qualities, or the more problems, I guess, we've sort of found along the way. And I think good rehabilitation obviously addresses all those problems, particularly at the end stage.
Yeah. So I think, we're all quite good at thinking about getting range of motion back. We're thinking about trying to get people strong.
Yeah.
You mentioned a few sort of other sort of metrics like rate of force development. Can you maybe talk a little bit more about how you think about those things and how you might measure those things?
Yeah. So obviously we went through a phase with obviously horizontal hopping, so triple hops, etc. And we sort of spit out a number, an objective number. So however many centimeters each side, and once an athlete could tick that off, or had 10%, different side to side, we were kind of happy with that, if that makes sense. But now with the use of with force plates, obviously 3D cameras, if you're lucky enough to use that, or biomechanical analysis, such as the guys at Pitch Ready, we obviously can start to find out not only what the athlete is doing or what number they're producing, but also how they're doing that as well. So their strategy. So obviously, we touched on rate of force development. So obviously the rate at which an athlete can produce force, and we know that it is one of the main detriments for athletes throughout their ACL rehabilitation. So how quickly they can produce force specifically in their quadriceps, or their whole limb really, but specifically their quads. How quickly they can produce force on their injured limb compared to their uninjured limb. And that's a deficit that is ongoing. And it's something that I've probably found isn't well addressed in the community level, mainly because we don't have the tools to sort of measure it, although that's becoming a lot more popular now, compared to, how we measure it in an elite sport level. And the caveat to that is a lot of people might not measure it because then they're not too sure of how to train it or how to improve it once they find it. So it's one thing, obviously, measuring these qualities, but then obviously how we improve them is probably the bigger part of the picture.
Yeah. So I think one of the things that the athlete is always really keen to know, and coaches and performance staff, they really want to know, when is an athlete ready to do the next thing? When are they ready to run? Be able to share some ideas about how you think or objective measurements that you might use to progress people through their rehabilitation? Maybe focusing on when do you think people are able to start running? What do they have to be able to do to tick that off?
Yeah, so for anything, my philosophy is always working backwards from the goal, and obviously from a running perspective, um, we want to know a few things. The first thing, and this is something that should be done even in a clinical level, not so much at a high performance sport level, but we want to know, is the knee quiet? Because obviously, if the knee's quiet, it obviously gives us a higher rate of success, obviously. So no effusion. Want to know if it's compliant to bend. And bend under load. So what I mean by that is, can you flex and extend the knee under load? So that's your single leg squats, single leg box squats, etc. And obviously from a running perspective, what's the capacity of the athlete? So not only can they do it, 3 times or 5 times, how many can they do box squats compared to their uninjured side? The other thing that's becoming really quite popular in the literature as well, and that is calf strength testing, because obviously we know the soleus in particular, but obviously the calf complex, helps protect the knee, especially if we have good ankle stiffness. So I want to know that from an endurance perspective, can the athlete, how many calf raises can the athlete do? But also, if you're lucky enough to have a force frame or forced X, what's their maximum soleal strength? And we at the Warriors, we went off about 1.5 times body weight, which is consistent with a lot of the other research out there. But we just found that if our athletes could tolerate 1.5 times body weight of a seated calf raise, then they were going to set themselves up better to succeed. Doesn't mean that and with all these tests, it doesn't mean that we don't run them if they can't do it. It's just about us creating a picture of where the athlete's deficits are, and sort of taking on a risk assessment of whether they're going to be able to do the task if this particular test is down, if that makes sense.
Yeah.
I think the other thing as well is, when you start running, there's a lot of force going through the knee. So if you have the ability to measure, maximum strength testing, whether it's a single leg, 3RM or 5RM on a leg press, and then obviously your key lifts in the gym. So when you're a squatter, when you trap bar deadlift, when you do leg press, what's your maximum strength like, or your maximum strength capacity like? I think we can get in trouble if we just measure strength endurance qualities and not actually measure the other end of the curve as well.
Yeah. So you talked a lot there about measuring and I guess rebuilding strength. What about some of the other types of rehabilitation activities? So I see guys using a lot of bands. I see you using some of the, I don't know what they're called, but the power bags with water in it, so you get some perturbation. Can you talk through some of those kind of not purely strength-based tests and exercises?
Yeah, so there's a few ways to use bands, and obviously we're just trying to create different stimulus for the athletes depending on their sport. So I use bands in a few ways. The first way is obviously to take, if you're in a rehab setting, is to take the force out of a landing. So bands are a really good way to bridge the gap. Say, for example, if you're doing a horizontal jump, like a broad jump, so double leg jump as far as you can, having a band not only acts as a stimulus to help the athlete push their hips through the band, but also takes the sting out of the landing. So if you're sort of transitioning into jump land sort of stuff, or sort of exercises, I should say, bands can be really useful. The same as if you're doing a vertical jump, using a band can obviously take the landing component out of it, or the eccentric component out of it. Conversely, you can obviously also use bands in to provide an overload stimulus eccentrically if an athlete is up to that, because obviously eccentric capacities is something that's obviously really needed, especially before we start doing things like changing direction or decelerating. So using bands to overload certain exercises can really add value in that way. You touched on aquabags. So aquabags obviously split coaches straight down the middle. Some people really like them and some people don't. I probably sit on the more like them than not, because I think that you can get a proprioceptive or trunk control overload with them, which is obviously super important for athletes who are going through ACL rehab. Can they dissociate their trunk from their hips or from their lower body? And then the Acrobag just gives you that, that overload essentially to that quality, kind of like a weight does for strength.
Yeah. And I think one of the things that in a high performance or professional sport environment that gets there's a lot of focus on, that there's almost no focus on at a community level,
Yeah.
are some of the on field training. So the things that the athlete then does on the pitch to prepare themselves. Can
Yeah.
you talk a little bit about those?
Yeah, I think it's all built around time. Obviously, we're really lucky that we get to work with these guys, 5 days a week, and we plan their whole week out. I think it is a massive gap in the community, and I think it's an area where people can obviously invest a lot of time into, because I think it's the most important, the coaching element. But essentially, from when you see an athlete starting to run in a straight line, you should be able to start layering in the next element. So whether that's change of direction. So if an athlete can only run in a straight line, but they're not ready to start changing direction yet, if you're with them, you can start layering in lower intensity drills. So, lateral movements, or, stepping movements while walking, or again, band resisted movements. And again, obviously, if you're with them, you obviously have more control over it, and you have, I guess, it makes you feel a little bit better knowing that they're doing it under your care. The field loading should always be, again, done working backwards from your end goal. So whether it's a soccer player or a rugby league player, you're always thinking about the type of movements that they need to be able to do when they return to play, and you're working backwards from that. And at the Warriors, we had a really strong focus on obviously front loading those movements in the gym first. So making sure that, and I think this is well done rehab everywhere, but front loading those movements in the gym, whether it's a lateral movement, a rotational movement, decelerating movements, or movements with high eccentric forces, before we then put athletes on the pitch and started, getting them to change direction or stop suddenly or accelerate, rapidly, if that makes sense.
Yeah. And I guess, do you have any tricks or tips for on-field things that you think work very well?
I think the biggest thing is I think coaching is a real key, and I feel like it's an area where the physiotherapy profession is growing a little bit more, but actually getting out there and watching athletes run, and it can be really hard, because I remember when I worked in the clinic, um, you would send your athlete away with a running session, and they'd come back and they either got through it, or they didn't get through it, but you're not quite sure of the reasons why, because you weren't there with them. So wherever you can, try and get yourself out to a session on the field and obviously watch them. But also an underrated tip that I still had to remind myself to do is to even at the Warriors, is to film the athlete, or get them to film themselves, see how they're running, see how they're moving, see how they change direction, because that is the key. Because athletes are really sneaky at hiding certain things, or not telling you perhaps the whole truth. You might have an athlete that you send away for a running session, and they come back in with a swollen knee. And they said that they felt fine running, but actually when you watched it, there was a significant discrepancy between how they were running, or their limbs when they were running. So I think that would be the key. In terms of the field work, I think keys on the field, I think the biggest thing is obviously making sure that you expose your athletes to chaos. I know, again, at the Warriors, we've unluckily had a few ACLs recently, so it's a topic that we've been talking about. But chaos in terms of, changing direction, even from a reactive point of view, going to a cone with a different color, or yelling out a number, all those sort of reactive drills are really great. But you need to have athletes responding to chaos, whether that means you run in front of them, you get them to jump over things, you just make it really chaotic for them before you put them into drills. And I feel like potentially that's where we could miss that step in the community, just because we don't have enough bodies to do it, or we just don't have the coaches to do it.
Okay. One of the things that we've had to deal with together over the last 12 months is rehabbing a second ACL. So when you're approaching someone who's rehabbing their second ACL, is there anything that you think about or do differently from someone who's had their first injury?
It's interesting because obviously the one thing that I found very interesting in this rehab in particular is how quiet the knee was compared to a fresh ACL. So the second injuries happened, um, and the athlete obviously, we assessed the athlete, and a few days later, their knee was really functioning quite well compared to this is the person who's had the second ACL compared to say a fresh ACL. They get the bigger fusion, pain, stiffness. So I think from a second ACL perspective, I was really surprised with how much prehab we could get into them, like good quality prehab. Um, you know, compared to obviously the first ACL where we're just trying to really get extension and settle the knee down. In terms of towards the end stage, I would definitely like everything would be objective, but I would just be adding time in terms of the exposure to how many reps they get when they start getting back into team training. I think there can be a lot of psychological trauma that comes and stigma that comes with a second ACL. And I think that there's no real reason to rush that process. So if, for example, someone's so you're going to give someone 4 weeks of full team training after their first ACL at the back end, you might consider giving them the second ACL 6 weeks, etc. Or you might spend a little bit longer when they first integrate into team skills. And I think that also depends on the mechanism as well. Like if the second ACL was a contact mechanism, you might not change too much. The second ACL is a clear non-contact mechanism, catastrophic sort of knee injury, then you obviously might spend a little bit more time on, stepping movements or your biomechanical work, etc.
Yeah.
Does that make sense?
Yeah, I think so. I guess maybe just to wrap up, you've talked about a bunch of things and technologies that you've been able to use at the elite level. Have you got any kind of takeaways for community physiotherapists who are rehabbing ACLs maybe less frequently and maybe more independently on their own?
I think I've actually been asked this a few times, and I think the first thing is that you need to recognize, and I probably didn't when I was first as an undergrad, you need to recognize that it is a big injury and there's more to it than just the knee. And I think that doesn't matter whether you're an elite at an elite level or not, but you've got the knee, but then you've got the psychological trauma, you've got the pressure. If it's happened to an adolescent, you've got obviously the pressure from the parents. And sometimes you just need to ask for help. And I think that not everyone in the community is equipped with rehabbing an ACL from the start to the finish, and that's completely okay. You might not have the technology to give the person the best chance to succeed. You might not have the skill set to give the person the best chance to succeed at the end stage, especially if you don't have experience in strength and conditioning, or the sport itself is a big one. I'm really lucky I get to work with Aussie rules footballers, which is a sport I like. I've previously worked in league, which is a sport I love. But if someone came in, from a sport that I didn't have any idea about, then I'd have to go and obviously learn about that sport or refer them to a physio who sort of works in that sport. And I think that's a really important piece. I think if you don't have the experience or the technology to sort of look after the rehab the whole way through, it's completely okay to refer to someone or even ask someone for help. You don't have to feel like you're doing it all by yourself. As I said at the start, physios, we should all have the skills to look after that early stage. But when the athlete starts getting into that mid to late stage, you really need to ask yourself whether you are the best person to be looking after them. Because if you're not, you're kind of doing them a disservice, especially with the technology or the education that's out there at the moment. So that probably be
Yeah, that's a really interesting point. It doesn't mean that you're giving the patient away. It's just you're sharing them with someone else. So I think there's an interesting role for people to help with that end stage rehab, isn't it?
Yeah, and I think like we're in high performance sport, like if you think about it, a lot of the time physios are working collaboratively, obviously with sports doctors like yourself, but as strength and conditioning coaches at that end stage, they're really, there's not many physios who do strength and conditioning, which is completely fine. So Even in our environment, it's collaborative. And I know obviously from a clinic perspective, it can be a little bit different, but you aren't giving the patient away. And I think the other thing that patients with social media, especially, I was surprised how many athletes and patients, or probably not surprised anymore, actually, and our boys who tore their ACL would actually say this, how much their social media algorithm changes. And so athletes aren't silly. If they realize that you've still just got them doing bodyweight squats and they're 6 months post, but on social media, they're seeing athletes doing, plyometrics, strength training, etc. They're going to figure it out anyway, at most of the time. So you're probably better off, if you don't have the technology, referring them on and being there to help them, because I'd appreciate that more.
Yeah. Well, that is an incredible segue. Just to thank everyone for tuning in and direct you towards our Instagram account, which is the Spin Access. So I wasn't planning on doing it, but I'm sure that the marketing department will be happy. But you can also find us on Facebook and LinkedIn by searching for Access Sports Medicine. So we are planning on pushing out some more content like this and some other kind of more traditional written content. So if you're keen to learn a little bit more about what's happening at Access and what's happening in the teams and athletes that we look after, that's a good spot to be. So Jackson, it's great to see you.
Yeah.
I'm going to miss our weekend runs after away games, so hopefully we can still do those, a few of those in Brisbane. Really, thanks for giving up your time on a I'm sure beautiful Brisbane afternoon, and I'm looking forward to catching up with you soon.
Thanks, mate. I appreciate it.